Hello, everybody, and welcome to the latest edition of the BG Insights Videocast. Super excited today to be joined by our wonderful friends from the Joe Andruzzi Foundation. Jen and Karen, welcome.
Thank
Hello.
you.
Thanks for having us.
Nice to see you.
And I am joined by my lovely co-host, Megan Page, who Megan and I have worked together for a long time, and she works with Karen and Jen on this particular account. And I'm really excited. We love our nonprofit work. It's a way for us to give back. And I love your story, Karen. I love your story, Jen. I love the JAF story and the impact you've made. I have friends who have been impacted by JAF, and cancer is one of those things that everybody has been touched with in some way, shape, or form, which is it's a beautiful thing to have organizations like yours out there fighting that good fight. We'll get into the things like cost of cancer, but for now, I want to just both thank you for being here. I'm going to pass it off to Megan Page.
Hi, everyone. Thanks, Jen. Thanks, Karen, for joining. So just to tag on to your intro for a second, Don, so folks know who we're talking with here. Jen Andruzzi is the co-founder, president, and CEO of the Joe Andruzzi Foundation, and Karen Glass is VP of Marketing and Communications over there. So thank you both for joining today and helping us to think through how different organizations are dealing with the different challenges that we're facing right now. So I have a series of questions here that we'll go through, and a couple are for you, Jen, a couple are for you, Karen, and feel free to tag team on them too if you guys want to. The first one I have is for Jen, and this is just thinking, bigger picture. What are some of the biggest changes that JAF has experienced since March when COVID-19 first began?
So I would say for JF, the biggest thing is that we were a team of 11 that all worked in office. We didn't have any, I should say 10 and a half worked in office every day. We have Casey Ford, who is remote 50% of the time, and he actually works with your team really closely on our marketing and comm team internally here. So I would say typically, other than Casey, we're in office, every, Monday through Friday and meeting with outside organizations, partners, from donors to hospital, social workers to patients and families. And once, March 16th happened, I think the end of the week prior, so that, on March 13th was when we kind of said, things are really going to stop, right? I think everybody, at least if my memory serves me right, the schools basically were like closed that day, right? And then quickly, like within Saturday, Sunday, Monday happened, and it was like, we have to close the office. It's like, it was one of those very robotic, things that happen, So I think the biggest change, if I had to say the biggest, is that we're all separate. We're now all working from home. I should say, there's 3 staff members that are coming in part-time back into the office space in North Attleboro, but everybody else is remote. And we as an organization made the decision that no employee has to come back in 2020 in office, that everybody can work remotely. Because I have to say, like, even though we've had to make such a huge shift internally, the team has done an amazing job doing that. Mm-hmm. Everybody has excelled. They have really, they're working just as hard, if not harder. Not that they didn't work hard enough already, but, in home. And I would say, everybody's responsibilities are being met, exceeded, so there's really no reason for us to say, you need to come in. And I think what we're all appreciating is, the other thing is that we're all really strong individuals that, all have had different paths, but this is a path that nobody's been down. So learning the new norm for the entire world is challenging, but also learning how to do it as a working professional and go into the office space and do those things is really challenging. And I don't think many of the staff members would have considered themselves being a work from home person, like back in February, right? I think they enjoyed coming in the office and seeing their peers and collaborating next to one another. And now it's like, Teams all day or Zooms all day.
Yep.
Like I can't do it, but you got to respect that, to me, it's like no judgment, I continue to say that, because one day I might feel a certain way, but watch something on the news and I have a totally different reaction. So, so I'd say that's the workplace has definitely had to pivot.
I bet you the one thing you probably could say is the most consistent is your mission. Talk about the mission of the
Absolutely.
organization.
Yeah, like I would say the mission of the organization, providing financial assistance to cancer patients and families, has not changed. We have not, the only thing that we have had to pivot within our program is that there's one form that a patient will sign for JAF on behalf of themselves or a family member to have like permission to talk to a doctor. But because a lot of the patients in the community that we help might not have Wi-Fi or scanners or things that they can, get that document to, we've pivoted to say, okay, if that's something that your patient can't provide, they can send an email. It just has to match their application, right? So but if you think about that, that's a program where we're helping thousands of people a year, awarding $1 million out. And, because we're set up in the way that we are, we haven't had to make any huge changes. There's no loss for our patients. We haven't had to stop the program because of COVID. So even though our program manager, Shannon Glanty, has gone home and does work from home, because we've set ourselves up to have a robust system and platform so healthcare professionals can apply online on behalf of a cancer patient who needs help because of the cost of cancer, because they are, getting all those extra co-pays or expenses or prescriptions, and they're not able to pay for their mortgage for a month, or they're not able to put food on their table. Shannon's been able to work with those healthcare professionals by them filling out those online applications, her still reading them. God bless her. She brought home a printer. She brought home the checks. She brought home the stamps. So, she's had to pivot what she's done, but we haven't had to stop anything for the program.
That's amazing. And that's wonderful, because the work you guys are doing is so important. Karen, we've worked together on this some, but I'd love for you to share a little bit about how you guys have pivoted and what some of the new ways are that you're engaging with the JAF community now in this new normal, and how that's different than what you were doing previously.
Absolutely. And I think, as many organizations have, JF2 responded, as Jen talked about, when that's probably the one date that does stick in people's minds. I think time has lost meaning for many of us over these last few months, but really March 17th, right? And communicating with our constituency, we've really seen an uptick in that, because I think during this time, you really can't do too much. Mm-hmm. And I think, to Jen's point, one of the first sets of communications earlier in March that we really wanted people to know, certainly our patients and social workers, but the rest of our community, that nothing has changed. We've all gone to work remotely, but you still have access to everything. As Jen said, really not missing a beat was so important. As Jen alluded to, in our mission and the cost of cancer, I think what we've started to see, obviously, is COVID's impact really just exacerbating that. Mm-hmm. The fact is that we've always talked about this, and you guys have certainly worked with us on this, that, when a diagnosis happens and a patient can't work, or their caregiver can't, and suddenly household income, it drops to one or maybe part of one, that's when the bills start to get hard, and paying for your everyday things, right? Your housing and your food and your transportation. And I think what Jen and the rest of the team, what we've seen is, COVID has now dialed that up for just about everybody in America. And so many people are starting to see and feel what our patients have been going through. And so I think in many ways, the pandemic and the social distancing has helped us actually find ways to communicate even more with our constituents. And we certainly have tried to share even more patient stories, some more of our mission focus, helping to educate people about what's happening. And really, that's a lot of the written side of it. And I think we saw an opportunity to help more visualize, if you will, and really embrace the world of virtual and Zoom, as Jen said. And we launched Faces of JAF. And as the name implies, it's an opportunity for us to actually have similar to the, conversations with our community, the faces, the people who make up JAF. And it's everything from our social worker partners and patients, supporters, donors, Team JF athletes, trying to pull everybody together and help, again, sort of feel more of a sense of unity. I think, and we've continued it, even though the lockdown has stopped, we really found a way that it helps people see one another and feel part of a larger and a greater good. I think we've talked about this too, Don. I know you and I have chatted that, in times like these, people need to feel positivity and that it isn't all dark news and that there is a chance and hope. And I think, that's part of our mission statement, right? Bringing hope. And I think these Faces of JF conversations have really given us that opportunity to sometimes share a smile, sometimes a tear, right, Jen? I mean, I think, you've done a great job in all these conversations with our community. But I think having that has really brought people together in a more engaging way.
It's been great to see too, I think it's been great to see just the engagement with putting those stories out there, putting those kind of video profiles out there from different members of the community. And it's clearly there's an appetite for it from the engagement that you all have seen from it, which is fantastic. And I think also speaks to the fact that, we're all living in this digital world right now. And you guys are pivoting, to think about engaging more in that way too. Do you want to talk a little bit about that?
Absolutely. I think because we can't gather, and a lot of what JF does is sort of, whether it's different smaller events or get-togethers, we've seen and utilized this format. Team JF, Jen has that great racing bib behind you there. We have a lot of athletes who support the organization, and so Jillian O'Brien, who manages that group, she's utilized a lot of this. So we've brought together our Team JF athletes, whether Boston Marathon, Falmouth Road Race, which is coming up. Again, opportunities to bring our athletes, our patients together, staff together. So again, those might be little microcosms of that larger community, like we were saying. And so there's been that, and we are embracing the virtual event. And so at the end of August, we'll be hosting JF's first virtual event, and we're eagerly anticipating that. It's one of those things where, and I think Jen would agree, and I know our development team, as we've talked about events, there's always been that thought of, maybe we should try something different. Or so when something like this happens, as I think Jen said, right, there is no playbook. It gives you the opportunity to innovate. And so we're actually trying to embrace the fact that, well, maybe it's a good thing that it's not just how many people are fitting into a room for an event. Now we can invite everybody. And I think that's the opportunity we have to have more people become aware of what JF is doing and how we're helping patients in New England, and really take advantage of that. So still a little scary, but we are looking forward to the virtual events.
Well, this reminds me a lot of when, the first meeting we had as a group when you were in search for an agency, and, we talked about, financial toxicity, which it's taken me this long to have that roll off my tongue comfortably, because I speak fast and I talk fast, and it's hard for me to use that term. And we ended up collaboratively coming up with the cost of cancer. And I think that, Jen, you've clearly pivoted to that talking point, which is great because it kind of clearly refines your message. But I think this time I'd love to have both you talk about it, Jen, from a running a business standpoint, and Karen from a marketing standpoint. We're in an environment where testing and perfecting is okay, because we are sort of in this unknown. I think about, managing my talented staff from afar when I'm a chatty Cathy. I like going to the water cooler and having, hey, Megan, how's the kids? What's going on? I just love to engage with people. And I turn around, it's me and the dog and the kids, and Phil's not there. My team is not there. So it's from Jen, from your perspective, talk about how you've been able to pivot to sort of this framework of cost of cancer, but really as a way to guide your business, right? Because you're a nonprofit, but you are a business. You're trying to drive revenue. What's that been like, just from thinking differently and trying new things from your perspective? Corporate partners, how to engage with them. What's that look like from your perspective?
Yeah, so I would say, in the beginning of, the pandemic, there were some nonprofits that were pivoting immediately and creating new programs and establishing funds for COVID-19 relief, right? And those are great and needed. And, I've spoken to healthcare professionals that have said, that they really appreciated those funds that came up right away. But we as an organization, JF, myself, the board, and JF's leadership, we made the decision that, we already, to us, what JF does for patients in the community that we're serving is we are giving financial relief. That's what we've been doing since 2008, right? So we're not looking to invent something new. We want to improve and innovate what we're already doing. We did not create a COVID-19 fund. We created a COVID-19 relief fund campaign to help fundraise, right? Because what happened as, events got canceled and things like that, we did lose in the spring $500,000 in revenue from cancellation of events. And, that's something that as an organization, for profit or nonprofit, you can imagine is really challenging, right? I will say that the development team stepped up though. They created plans immediately to talk to major donors, earlier in the year, that we were able to get a handful of major donors to make their contribution in Q2 versus Q3 or Q4. And the marketing team has done a great job, by creating Faces of JF, putting things out on social media, where we have just organically, from those initiatives, have gotten general donations. So I would say, sharing the mission has been a huge thing of what, the work we continue to do, but we're not really shifting or pivoting it, if that makes sense. We're going to continue to do the same thing we plan to do in the beginning of the year, whereas continue to invest in the program and make sure that we are providing a solution to our community that helps them at their greatest need, or in their greatest need area. So I would say, from a development standpoint, even though, like I say, yes, we were able to in Q2, still have those revenue dollars come in because of our major donors stepping up and making those contributions. That was like the immediate. And so right now, as an organization, we've been able to stay true to what the mission is. We've been able to stay true to our budget. But the time that we really have to now zone in on is current. So Q3 and Q4, because as JF has evolved over the years, our major event that raised the most money is our gala, and that is in Q4, and that's like $1 million event. And right now, we're not going to have an in-person event, right? Like, as you can imagine. So we have gotten, verbal agreements from sponsors who have sponsored in the past that have said that they will step up and they will support if we have a virtual or whatever we do decide to have at the end of the day for that annual event. But it's not going to be $1 million, right? And so my role as the president and CEO is to take that step back and really have that helicopter view to say, how is that going to then affect the organization? You know, what are the things that we need, that are musts, and what are the things that aren't, right? And I have to say, like, JF is already a very lean machine, right? So like, we don't have like frilly things. Like most people bring in all of their, you know, like there's not, you know, nobody gets an expense budget to decorate their office space, or we're a nonprofit, you know, we don't have a ton of supplies that we're ordering, or there's not. So to cut costs means that the program will have an effect at the end of the day, right? If it is that we have to, you know, give less to a patient family, or if it is we have to look at a role of a staff member, like every staff member adds value. And if we were to have to face that, like that would mean at the end of the day, it would affect the program, because everybody has such a huge role in the outcome of the program. It's not, you know, way beyond myself, Joe, our program manager. I mean, everybody is affected by that, you know, even to the point of like the partnerships that we have down, that you asked, you know, how are the partnerships, you know, they have an effect on it, right? So if I don't have a staff member that can go and talk to our great partners at Empower Retirement, then who's going to do that, right? So it's like you can't miss a puzzle piece. We need every puzzle piece, and it is going to be challenging more to the later part of the year, right? But we know that, and we're going to make the decisions earlier so we can be really strategic and not be reactive.
Mm-hmm. Makes total sense. I mean, I think your overheads for events can be expensive. You know, golf courses, venues, food, all that stuff adds up. So now if you eliminate all that, you're now it's your time you're putting in to manage the events. And so Megan and I, we've been talking to our nonprofit clients about sort of micro galas, micro events, to do more touch points and make them more personalized, smaller, to get in front of, you know, segmented audiences versus your entire audience, because not everybody's going to sit there for an hour and a half on a Zoom call and go through the typical paces of a gala. We've seen, you know, virtual galas that are 20 minutes to 30 minutes, but they're kind of quick hitting because now it's more of a repetitive process, but sort of kind of get into the micro of the personas of folks you're trying to reach. So it's a challenge. And I think they're, you know, like you and others in the nonprofit world will do more of these sort of techniques and tactics and learn from each time. And obviously, Karen, love to have you speak a little bit about, now that we're at where we are now, with that in mind, with no events and virtual events and so on and so forth, what's on the roadmap for JF? You know, you obviously, you have a little bit of a leg up because you have a brand name, right? You have some visibility, but you're in a very competitive industry, if you will, right? Cancer is competitive, right? The 2 C words. How do you compete in that space? What's on the horizon for JF?
Yeah, it's an excellent point too, Don. And really, I would say, you know, for an organization of our size, one of the tactics, again, we'll look at the opportunities of what the pandemic is bringing, right? We had always sort of dabbled in paid social media. It's something that we had sort of done, but on a lower level, we weren't 100% sure the best approach. Again, pulling together really a full-fledged media plan for that. And when we did launch Faces of JF, and we certainly came to you guys and said, okay, we recognize it's all about JF community, but there's, like we just said, right, there are no shackles on us. We can go as broad as we want. And frankly, let's build that community. So to your point a second ago, Don, you know, it is competitive. How do we make sure that there is awareness? Take nothing for granted in this new environment. And I mean, you guys were great because you saw the opportunities and put together a full plan for Faces of JF. And we were really pleased with the results that we saw in terms of our reach and our impressions. And we said, okay, there is, and I think, Megan, you were saying this too, the response that people had to it. And I think that's partially due to, unfortunately, the fact that everyone has been impacted by cancer at some point. I also think, again, the mission and what we're trying to accomplish and really make sure that people have the basic necessities I think there's just a heightened awareness of that because of what everyone's really going through right now in the country. So we saw that it resonated. We're seeing attraction with that. And also, as Jen alluded to, there are no extra pennies lying around at the office. So the fact that when we did launch that campaign and we saw really great, great response, but low cost per click. So that was another great opportunity for us. And so as we looked at the rest of the calendar, and we've been working with the team at Belfort too to say, these are the opportunities, and as Jen was alluding to, we've got some other events. They might be virtual, they're going to be virtual, but we also have some other things that we're trying to create awareness for the organization and opportunities where people who want to support can do so. And how do we get them back to our website, understand more about the mission, and be able to donate? And so really, before we may have dabbled or put our toe in the water, here's the opportunity to just dive right in. We've seen some initial success, and we're looking to incorporate that. It's really a key part of our plan for the rest of the year. Because whatever might continue to change, it's social distancing. It just depends to what level it ramps up. So we're not going to be able to have those get-togethers, but that's okay. And I think to your point too, Don, the ability with paid social is the fact that you can segment. So we can actually look at some different ways of targeting and making sure we're shifting some of our messaging. And that could be obviously the content, but also who we're speaking with as well, and making that even more relevant so that the engagement is truly hitting home. So again, trying to really see it, and you said it, test and learn. I don't think we're going to be shy about that. I think the fact was we were willing to embrace that, and I think the great part of working with the team, with Ariel and the team and Sydney, that you guys at Belfort are also really, it's the responsiveness. Okay, did that work? Did it not? Let's shift. And I think Jen would agree too. That's really a lot of the conversations we keep having at our leadership, our internal leadership meetings too. Should we do this? Let's try it. And quickly find out and assess. Did it work? Did it not? And it's probably not even that black and white. It worked, but it might work better if. And take those learnings and apply them.
It is an interesting time, Karen, because, it's like in terms of the test and learn and being able to pivot quickly, it's really important that we're pivoting quickly right now because we don't have a long horizon, right, to reach the goals that you all need to reach. So it's important to be able to take those learnings and adjust. And you guys have been doing an amazing job as an organization, being nimble and kind of rethinking about how to engage with your constituents right now. So thank you for diving into that a little bit. Is there anything, Jen or Karen, I know I'm just conscious of time here. Is there anything else that you all would like to talk about or just share about JAF or kind of priorities that you're seeing in terms of grant recipients or anything else you want to share before we wrap up here?
Karen, is there anything that you think we missed?
I think we've talked a lot about obviously what JF has set for the rest of the year. And I think Jen could probably speak more to this because she talks more with our healthcare partners, but I would say the need or the cost of cancer, I think we're seeing or are projecting the increase, the impact of COVID on this audience. And I think that's what is also happening, I think, in the second half of the year. I think the fact is some of the safety nets that have been put in place initially to help people, some of them are expiring, and it depends if they're going to be put back into place. And again, will there be, assistance financially? Will we see continued forbearance of rent and mortgage? If we don't, I think the thought is we are going to see, I don't even know if wave is a strong enough term, perhaps a tsunami, because that's going to impact so many people, and particularly an audience that was on a financial edge to begin with and didn't need much of a tipping point. And I think, I'll turn it to Jen, because I think you've talked to a lot of our social worker partners who've expressed that fear of what can come, what might be around the bend also for JF to work with.
Yeah, no, I think you hit it really on the nail on the head, is that, not only are we going to be focusing the next 6 months on how the organization is pivoting, but we really have to be mindful of how healthcare providers are going to have to pivot to support their patient community. And for like various reasons. I would say number one is that a lot of social workers or financial navigators, dependent on the system, they really haven't had in-person meetings with their patients. They are, and they don't do telehealth for most of them because it's not billable. So a lot of them do phone calls if they don't have in-person visits. And as you can imagine, that can be challenging, right? So a lot of patients, their financial need isn't even being assessed right now because they're not inpatient, or having inpatient communication with their provider, or in office, I should say, forgive me, with their provider. They're doing telehealth with maybe their doctor or with other team members on their team, and their treatment protocols have also been shifted because they don't want patients in the office as frequently. So some patients that would go in for a chemo treatment, every 2 weeks, their treatment has been modified where they actually have a visiting nurse that comes in their home every 30 days, right? So that's another reason, that's another barrier that they're not even being seen by the social worker staff. So I would say first and foremost is, I think there's current need that's not being identified because they're not seeing their healthcare providers. I think the second to what Karen said is that there are these government supports that have been put up in place, but each one is gradually being taken down. And so for a family that's already at a financial hardship because mom's laid off, because is a breast cancer patient, dad's out of work because he's caring for the toddlers at home, right? They're already at a financial hardship. And now you add COVID, so they have financial relief, but so great, we're good for a few months. And then all of a sudden, to Karen's point, the tidal wave comes in. It's like, well, it's stripped all away. And now you have these mounting bills, right? Because it's not that it was taken away, right? Those things weren't taken away. They were just put on the back or paused. So I think that's going to be a real financial barrier for cancer patients because cancer doesn't stop. Bills don't stop. Just because we had COVID and just because we had, things that, mortgage forbearance, doesn't mean any of the worries that cancer patients have gone away. Their worries, honestly, like Karen mentioned, they're mounting right now, and especially right now, because they know that just around the corner is when they're going to have to make that payment. Right. And then I would say lastly, or two things, sorry, is that one thing that we're hearing is that there's patients that never needed JF's help before because they had, maybe mom stayed home because she was fighting breast cancer and dad was work from home, right? He was able to work from home, but now dad's laid off, right? Because of COVID, because of, a reorg, because the company had to pivot. And now they do need support. They are going to need JFs. So we've heard that, there's a percentage of the population that never needed JF's resources before that will actually now be turning to us. And I would say the last thing is that, new patients haven't gone in. They're not going in. We heard Governor Baker months ago tell us that if we have the signs of stroke, go in. If you feel something, go to a doctor, seek medical attention. Don't be afraid to go in because of COVID. Again, it's easy to say those things but to make people, we can't tell people how to feel, right? So a lot of people that are finding that they might not feel good, all the signs of cancer diagnosis, they're pushing those things off because number one, they could think it's just anxiety because we all have it right now. It's very normalized right now. And they're not contacting their doctor. and they're not even thinking maybe cancer because they're thinking of all these other things, right? So in the fall, there's going to be a large population of new diagnoses that I've heard from Rhode Island healthcare professionals, Massachusetts, and Maine have all three separately have said those things. And that, again, that's going to create another, another wave of applications for those patients that can't afford the cost of cancer, right? And when we say cost of cancer, it really means like you don't get to wait to have a savings account to go and take 6 months off of work to recover from surgery, to then go into chemo, to then go into radiation. Nobody has that. So the cost of cancer is not only is it ripping apart your body, your mental health, it's making you take a pause on what you are doing every day, what you are able to do and afford every day. And for, if it were parents or a single person, I don't know the general population, Karen always says like most of Americans don't even have $1,000 in their savings account, right? Well, you take 1 month of copays and you could be at $1,000 within a week if you add in prescription meds, right? So like, the cost of cancer is so great. Recently, I'll just share quick, is that, I've been doing this for 13-ish years now, and I've been involved in oncology community a little bit longer than that. But recently, I did the One Mission Buzz Off, and that's why I have a hat on, because I'm starting to look a little goofy. I have like spiky hair.
Join the party, Jen.
I'm starting to look a little goofy. So,
looks great.
So, but I have to say, I've always said I want to shave my head, and sometimes in the female vein moment of like, I can't stand my hair anymore. I just want to shave it off, right? But being in this time that we're in right now, I don't know why, but I was like, I'm going to take the leap and I want to do it this year for One Mission. And I have to say, the parts of this that I've experienced are much greater than I could have ever imagined. The little things, and we're gonna actually talk about it in the coming weeks. We agreed that we would put something out, so I won't give it away. But I would say, we always can challenge ourselves to put ourselves in somebody else's shoes, and in this time of like of uncertainty, perception is such like an ugly thing for many, right? And I just think, including a cancer patient and what we see every day, that, we think we know what's going on, or oh my gosh, I can't imagine, they must feel like this. It's like, I like encourage everybody, like really sit with like, what does it feel like to be a cancer patient? What would it mean for my family to have to deal with the cost of cancer? Why should I consider giving to an organization like JF? Those are the things that we have choices right now, and all things aside, like we all have very little to give right now. But when you give, you want to make sure you're giving to the right community. And I would say the cancer community is not going anywhere. These people, these patients, these families, they need your help. So I would just say, go on joeandruzzifoundation.org, read the cancer, the patient profiles and learn about it, because cost of cancer is on every single one. And by the end of it, you will fully be aware of what Don would say is financial toxicity.
Good segue. I mean, I wrote down that you're right. Cancer just doesn't say, "Hey, I want to be there in about 2 months." Just you have a couple months to plan.
Right.
Unlike jury duty, right? You get the little card in the mail. You can
Yeah.
kind of go through it. Who do I know to get me out of jury duty? You can't get out of having cancer. But it's because of organizations like yours that help families through very, very difficult times. I know we've all had, have experienced it in some way, shape, or form. But I can't thank you, Jen and Karen, for joining us today on the BG Insights Videocast, sharing your stories. And I do encourage people to get involved in the organization, either volunteer time, donate money, introduce a partner, just connect, read the stories. It is truly just eye-opening. I know when we first got engaged and you gave away your 10,000th gift, to see you and Joe surprising the recipient and, I'm not crying, you're crying kind of thing. I was like, okay, that's okay. And the daughter, it's such an emotional thing, but the work that you all do is it's mountains out of molehills. It's really tough stuff. And I applaud you both and Joe and everybody in your organization from top down to continue to fight this fight through what's going on now. And we're proud to be your agency partner, and whatever we can do to support you all, we will do and continue to do, because we support the mission and support where you guys are going. So again, if I want to donate today, how can I do that, Karen?
JoeAndruzziFoundation.org. Again, as Jen said, there's patient stories, there's the faces of JF, but you'll see the donate button right there up at the top. So feel free to click on that. And again, thank you guys for having us come on today, because it's great chatting about JF. And again, the partnership we have with Belfort Group. You guys have been great. And there's a lot of work ahead of us. As Jen said, there's a lot of work we have to do. So we look forward to doing that with you guys.
Awesome. I would suggest folks follow them on social media as well. A lot of good content, a lot of good information, data, just some context to what they're doing. So again, thank you both, Jen and Karen, for joining us today. And for those who want to know about the Belfort Group, we're at thebelfortgroup.com, as well as the Belfort Group on socials. But again, until next time, we'll see you on the BG Insights Videocast. Thank you, Jen and Karen. Talk to you soon.